Health officials say with STD rates rising to record levels, more tools are needed. There's a new morning after CDC guidance to help curb the spread of sexually transmitted infections. And joining us this morning to talk more about this is Dr. Pradeep Kumar of Austin Gastroenterology. Thanks so much for joining us, doctor.
Good morning, Leslie. Good to see you.
Yeah, so tell us more about these CDC guidances. What does this mean? What's the morning after? How, and also why are the numbers rising?
Yeah, I know, interesting. I'm not exactly sure why the numbers are rising. Clearly, the answer would be, more exposure.
Right.
There's just more exposure to sexually transmitted diseases, safe practices that we've known about for a generation, at least 2 generations, are being less used, meaning using protected sex is happening less and less, and as soon as it starts rising in the community, it's easier to spread, and so we're seeing record levels in the last 10 years of all the different sexually transmitted diseases. We're seeing a rise in all of them, and in all groups, particularly young people, gay, bisexual, transgender women. And so these are the people in which we're seeing a marked rise in it. And because when it rises, it spreads as well. It's like any other infection. The CDC is thought to use what they call PEP, or post-exposure prophylaxis. And this is out-of-the-box thinking, which is that for those groups that I just said, gay, bisexual, and transgender women, that if they have unprotected sex, that within 3 days they should take an antibiotic, doxycycline 200 milligrams, and that can reduce the spread of sexually transmitted diseases. It's been shown in Europe, and they want to implement it here in the United States.
Yeah, how does this antibiotic work? Can you go and just pick it up at the pharmacy? Do you need a prescription? How does that happen?
Yeah, you're going to have to need a prescription because antibiotics here are not available. But the first step is to get CDC guidelines to allow it to occur. And then they're going to try to spread information, allowing primary care physicians and those places at risk, the healthcare centers where they treat at-risk people, to make this more available, and then make it known to these community groups that this is what they recommend, and particularly people that have had it before in the last 12 months. Right. Those are specifically the people at highest risk, and so one would think that they would not want to get it again. And if you know that these guidelines are bound, then you could go and seek that kind of therapy.
Yeah. Other than the antibiotic, doctor, what are some other ways to make sure people are practicing safe sexual health?
Yeah. I think it's important to spread this kind of information that safe sex is important for your health. Of course, wearing condoms during sex helps prevent pregnancy if it's heterosexual sex. But even when it's not, and you're not trying to prevent pregnancy, that preventing health, sexually transmitted diseases such as HIV, syphilis, gonorrhea, chlamydia, that these can have a negative health impact. It's not just the pain of having the infection. It can affect organs. It can cause long-term damage, irrecoverable damage sometimes. And, it's important to try to prevent that. And so spreading information that these diseases are on the rise, that people are at risk when they have unprotected sex, and that they ought to consider doing that more commonly. But if you decide not to do that, that post-exposure prophylaxis is out-of-the-box thinking that'll at least reduce your risk of contracting these diseases.
All right. Well, we appreciate your time this morning. As always, we'll leave it right there. If you have a question for Dr. Kumar, you can email us at askdrkumar@gmail.com. Also, check out his website, drkumar.com. Thanks for joining us. We'll be right back.